Welcome to the module on how to activate the on-call teleneurologist at O'Connor Hospital. Once you're requested to activate the on-call teleneurologist for either an code stroke alert in the emergency department or the inpatient setting, simply find a local computer, check out the desktop, and what you're going to look for is an icon that either says Telemed IQ O'Connor Hospital or USC Keck Teleneurology. What you'll do is you'll left click twice on that icon. If you've activated Telemed before, like myself, automatically the window is going to open and you'll be prompted to start filling out the fields. For purposes of training for today, bear with me. I'm going to sign out here completely. And I'm going to go back here to the login to show you what it looks like from the beginning. So if you've not logged in before to Telemed IQ to activate teleneurology, this is what it looks like. So when you first log in, you're going to be asked for username and password. We don't have one. What you'll do is left click on looking for token login. You'll left click and the token for O'Connor is actually the word O'Connor. So you'll type in OCONN, O'Connor, no apostrophe, all lowercase. You'll then left click and sign in. You'll be immediately brought to the login page. All right. Now you'll simply left click on the icon that's the calendar, and notice as soon as I hover to discover, Dr. Peggy Wen's name pre-populates. All I do is left click on the calendar here, and if you noticed, as soon as I left click in the dark gray on the left, Dr. Peggy Wen's name pre-populated for today. Next, I need to come down to the USC Keck consult and select new. For the inpatient code stroke alerts, it'll always be a new consult because we are requesting a new consult for a new patient. The next thing they'll need to know is the patient's first name. So I'll type in the patient's first name. If I don't have it, I'll leave it blank. Then I'll type in the patient's last name. If I don't have it, I'll leave it blank. If I'm in the emergency department for a code stroke alert, I'll go back and send the name once I have it. If it's for an inpatient stroke alert, I'll have the patient's name based on the label and I'll type it in at the time of activation. Again, if I have the patient's label at the time of the inpatient stroke alert, I'll put in the patient's medical record number. When I'm in the emergency room, I may not have a medical record number at the time of activation. I'll go back and add it later. I'm going to put in the visit number or the encounter number for the inpatient stroke alert because I'll have that from the label. Again, in the emergency room, I'm not going to wait for that. I'm not going to have it. I'm going to activate right away. Again, I'll put in date of birth. Have that. At the time of the inpatient code stroke alert, I won't have it in the emergency department at the time of activation. I'll go back and put it in later. But notice, folks, at the time of the date of birth, it's the year first and then the month and then the date. It's backwards. Okay, nothing we can do about that. That's how this is set up. I may not have the last known well time date. If you don't have it, leave it blank. For the time, if you don't have it, leave it blank. Now we get back to callback numbers. The callback number is a number you're instructing the on-call teleneurologist to use. Notice we have several. In the emergency department, we have a downtime phone number. The downtime phone number is critical. If the tele cart in the emergency department should go down, be unusable, this is a number that we will use. 99% of the time, the callback number in the emergency department is going to be the 3999. If we have a stroke alert that occurs on the fast track on the backside of the ED, we're going to be using 3955. If we have a callback number for an inpatient stroke alert that occurs in the ICU, the callback number is going to be the 947-2630. If we have an inpatient code stroke alert that occurs outside of the ICU, the rapid response nurse is attending outside of the ICU, the callback number could be 2971 or 2416. We need to know what phone number the on-call neurologist should use to contact the rapid response nurse. So if you're activating the on-call teleneurologist for an inpatient stroke alert that's outside of the ED, you need to make sure you know what number to have the activating teleneurologist call back. Okay, very important. Most of the time for the inpatient stroke alert, it's going to be the 2416, but again, we need to confirm that. And the cart. Which cart is the on-call teleneurologist going to remote into? We have two teleneurology carts. We have one located in the CT scanner. That is designated for our inpatient code stroke alerts. If it's a code stroke alert in the emergency department, the default cart is going to be the O'Connor Hospital ED cart. And that's it. You complete and hit send. If you are unsure if your activation went through, you can simply click on history at the top. And look at this. Here are all the recent activations for our on-call teleneurologist. Simply click on show details, and here is the last message that was sent on March 24th at 16:17. Not sure? Come up to the refresh button, click on refresh. And again, you have the most recent activations to the on-call teleneurologist. Thank you.